So we're going to continue on with our discussion about engaging the client and kind of look at some of the other skill sets. So we've been looking at the different processes, and we're still in the engagement process. And we're going to finish off some of the OR skills here. We won't do information and advising, but we will do the open-ended questions, affirmations, and summarizing. So open-ended questions. So you're probably familiar with this concept that open questions invite the person to think before responding and provides plenty of room on how they answer. So open-ended questions, as you know, are questions that don't lead to a yes/no response or a kind of short answer response. So, did you go out with your friends last night? Yes, no, versus what did you do last night, or how did things go for you last night when you went out with your friends? Or so open-ended questions kind of they invite sort of more involvement of the client. When we ask a lot of questions of clients, we start to train them to what the kind of information that we're looking for. And the difficult we sometimes get into is we get kind of obsessed with kind of assessment kind of questions. We're trying to kind of figure out what the diagnosis is or what the problem is, and and that has a place. But in terms of engaging with the client, we don't want to get kind of like they're being grilled or interviewed by the police or something. It's more we want to get them to tell their story. And so we want to ask questions that kind of open up the conversation and get them kind of thinking about things. A good question, is provocative for the client. It kind of gets them, okay, wow, Sort of an example I use sometimes, if you ask a person, are you right-handed or left-handed? Pretty quick, easy answer. But if you ask a person, how did you come to decide to hold the pen the way you hold your pen? That takes a little bit more thought. I have to kind of think about it. I have to kind of go back to how did I learn, right? And so a good question kind of should kind of get the client kind of thinking a bit, because kind of what we're trying to do with clients is kind of we're kind of stirring the pot. We're trying to kind of get the cobwebs kind of kind of the narrow thinking kind of out of there, and just kind of okay, right? We want to kind of take them kind of take them into themselves a little bit more. I don't know if I quite mean it that way, but kind of get them thinking kind of about things perhaps at a deeper level. Don't want yes, no, we want to expand the conversation. We want to create space. And often, open-ended questions start with, how did this happen? Or, what happened? Or tell me about, or describe, or what's your experience with? And so you kind of want to get your head around that phraseology. I know for me, it's actually one of the hardest things for me to do is make this shift to open-ended questions. So here we have an example of a closed-ended question. How much do you drink? Okay. So we could ask, similar things in different ways. So it's kind of open-ended question. What are your drinking habits like? Okay. Tell me about your drinking patterns, right? So kind of it gives you kind of more information. When you decide to drink, tell me about the circumstances, all right? Rather than, do you drink at home alone, right? Okay, tell me about the circumstance. Doesn't mean that like if you're doing kind of an assessment portion that you don't go down to the closed-ended question. That may be important if you're doing assessment. But we want to kind of, particularly in the engagement phase, we want to kind of just get the client telling us a story. I wonder what it would be like if you stopped. Right, so it gets the client kind of thinking. I'll give some kind of examples here. So if you take a question, did you take your medication today? Right. How could you convert that to an open-ended question? Right. How is it going with the meds? Right. So just how is it going, right? And then now here I use what we've talked about, kind of suicide risk assessments. Are you thinking of ending your life? Okay, so that's a closed-ended question. Now, when you do a suicide risk assessment, you do want to ask that as a closed-ended question, right? But you don't necessarily want to start there. And so you can start with sort of open-ended questions. Lots of people I see get thoughts of taking their own life. What's your experience with thoughts of suicide? Right. So an open-ended question, it's a normalizing question, but it opens the conversation and allows the client to tell you what they want to tell you, as opposed to being really sort of narrow and specific. Now, but just to be clear, when you're doing a risk assessment, you still do want to get to the question very specifically, are you thinking of ending your life? What are you thinking of doing? Okay. So open-ended questions is pretty straightforward, but it's a practice thing. Affirmations, again, kind of pretty straightforward. Affirmations are statements of strength for the client, about the client and his or her strength. So they instill hope. It's when we do affirmations, I mean, clients are kind of pretty beat up when they come to see us, and so they've kind of often don't have that focus in their vision, so to speak, to see their strengths and what they're bringing to the table. And so we want to make a point of identifying that, highlighting that, and being very sort of specific about it. One of the nuances is to not use the word I. I think you're a great person. Because that starts to create, sort of change the relationship a little bit, where you're the judge of their character. So we would be more inclined to say, you're a great person. Now, even just to sort of go on with that, you're a great person is pretty vague. You want to be very specific. You've got a lot of organizational skills. You care a lot about the people around you. And so we want to be sort of very specific. Now, my observation with clinicians, and I'd kind of encourage you to think about that, is that when it comes to affirmations, clinicians tend to kind of use the same phrases over and over again. Which isn't bad, but if you want to sort of move into sort of more advanced practice around affirmations, is you want to improve your vocabulary. You want to have more words and more dimensions that you can give feedback to clients on. And I'll put a thing in Canvas there on some dimensions that you can consider that may help you kind of expand your vocabulary. So I've got a couple examples here. Despite the fact that most of your friends continue to use, you've been able to find the courage to pursue your own path. Right. So we're affirming kind of the strength of the individual of setting out on their own and being able to kind of resist the pull that might be coming from their peers. Second example, you have a great sense of humor. That can go a long way in getting through a difficult time. Now, so the affirmation is really that you've got a great sense of humor. Right? Now, what I've done here is I've tagged on a statement here to state why that strength is a good thing. Right? So one of the things that can give your affirmation just a little bit more punch and a little bit more kind of strength is to say why it's a good thing. You have a great sense of humor. That can go a long way in getting through a difficult time. Right? So, one way that people struggle, or one way people get through difficult times, is by using a sense of humor, right? And so you're doing more than just sort of affirming at it, but you're also making a statement about it, which kind of gives it a bit more punch. Now, the last of our OR skills is summaries, which are really reflections, except kind of a collection. So in a summary, you want to sort of pull together the key pieces of what a client is saying. For the client, this is helpful because if you go back to sort of the client coming into us, they have a lot of thoughts in their head, it's kind of disorganized, and your summaries help organize it, gives the client sort of a sense of kind of structure and organization to their thinking, and often that's very kind of reaffirming. Sometimes when we have all these ideas and all these stresses kind of going around in our head, kind of getting it down to, okay, this is kind of the core of it. Helps us kind of have sort of kind of a greater sense of calm, and allows us to kind of focus on it, what needs to be done, kind of better. It shows that you're listening, and that you're paying attention, and so it takes work, and it seems to me, as I watch sort of clinicians kind of I do this, it means you kind of have to kind of pause the conversation now and again, and just kind of give that, okay, let's kind of pull it all together. Now, when you give a summary, it's just like with the reflections, you're making choices about what you're going to summarize. So you really want to be summarizing kind of the key aspects, and particularly aspects that are going to move your conversation forward. So again, this is kind of advanced practice, kind of strategic kind of move. But if you can kind of look at the kind of everything that the client is saying and say, what's important in that's going to help me move forward? And so in motivational interviewing, the things that are important is the language about change. When clients are talking about their reasons for change, you really want to kind of summarize that. And again, brief and to the point. You don't want to be talking longer than the client. Your summary shouldn't be longer than kind of what they've said to you. So, okay, well, that finishes off our OR skills, and we'll take a break.